From Caracas, I'm Cody Weddle, and we're joining you today from the Ezequiel Zamora Park here in Caracas. And today I'm joined by Dione Ereu. Now, he's the director of the Hugo Chavez Medical Brigade here in Caracas. It's a group of medical professionals formed recently, mainly with the goal of helping Venezuela's indigenous people. Mr. Ereu, thanks so much for joining us today. This must be a new organization and has the name of the former president, Hugo Chavez. So let's talk a little bit about how your organization was founded and what its purpose is.
Well, the organization was founded on December 18th of 2014 as part of a mandate of the revolution to provide assistance to the indigenous peoples of the upper Orinoco River, mainly in the Amazonas state. Once we arrived in there, we divided up into groups and went to different municipalities to cover a larger area. There were some areas lacking doctors to attend our indigenous peoples. Now, thanks to the Bolivarian Revolution, we have been able to access those areas and provide them with assistance, because they are also part of the revolution, and Commander Chavez laid claim to their rights, because we had a historical debt of about 500 years to our indigenous peoples. There is the Yanomami people, the Piaroa, the Hibis, the Juripaco. There are some other peoples living near the border and that from time to time cross it and come to our territory. Colombian ethnic groups, mainly Hibi people. We also do this to honor our Commander Chavez. Most of all, could study medicine thanks to the revolution. Our guiding principles have to be first and foremost humanistic, with a vocation for what we do, to provide them with the most assistance regardless of how much we're going to earn. Because they're also human beings, they're also Venezuelans, and they need our help, and we will continue to help them, thanks to the support of the Bolivarian Revolution.
So it's a very new organization. Tell me about some of the projects you've already worked on with the indigenous people here in Venezuela.
We have worked mainly along with the indigenous peoples. We work in tandem with the Ministry of Health. In late September, there will be more Cuban doctors coming to work with us. We are growing, because it doesn't matter who you are. What matters is that you are a revolutionary doctor. Here in Venezuela, doctors are trained, and they don't pay a penny for their training in any public institution, as is enshrined in our Constitution. In Article 87 and Article 88, it says that education is free and that should be guaranteed by the state. As part of the projects we're going to develop, we are going to improve the planned Salud Yanomami project in the upper Orinoco River area. 40 more doctors will go there and will be welcomed by their colleagues. We asked the Ministry of Health some help to refund healthcare units in remote areas. We are also working together with the cacique, the tribal chiefs. We have to bear in mind that in those areas there is no electricity. We have water thanks to the rivers, but there is no internet, for example. We are glad to count on the help of the National Armed Forces and National Guard, so we can access those territories by plane and by boat. Our main units are located at the mouth of the Orinoco River, in the Esmeralda community, and also in Platanal. I would say that my colleagues are anonymous heroes, because it is easy to be here in Caracas and work as a doctor, or in Maracay City, but going to the scrubland, to the forest, and live under the conditions in which our campesinos, the peasant farmers, live, is an act of patriotism. It means that you care about your country. We want to refund the Salud Yanomami project. From May up to this day, we have vaccinated more than 10,000 Yanomami for free.
Which are the vaccines you have?
with the pneumococcal vaccine and hepatitis vaccine, the BCG vaccine, tetanus vaccine, influenza vaccine, and malaria vaccine. Since it's a forestry area, there are several cases of malaria, and we guarantee their treatment of this disease.
And talk to me a little, you're talking a little bit there about sort of the state of the medical attention for those indigenous people. Tell me more about traditionally and currently, do they have access to medical services?
Since Commander Chavez put forward legislation for free healthcare, we have free healthcare for every citizen. However, there are some remote areas that make it more difficult for us to provide them with attention. We are not just doctors, we are also social workers. We set up the project, make suggestions to the state institutions on the improvement of healthcare units. We send medicines on a monthly basis. And if we talk about nationwide healthcare attention, the healthcare system now reaches areas that were not taken into consideration in the past. For example, here in Caracas, you go to the slums and there you see a healthcare unit with Cuban doctors from the Barrio Adentro mission. However, Commander Chavez thought of a bigger scope, and now you see 18,000 graduates, doctors, and you have more than 1,200 studying a specialty in Cuba, more than 30,000 in traditional universities. You will have about 60,000 doctors in 10 years. So this is a real revolution from the people. Which country exceeds that quantity? Only Cuba, with more than 27,000 foreign and Cuban doctors per year. Those doctors should work in all areas, mainly in primary attention. Now we send them to popular areas, meaning that we're creating the conditions to provide assistance to every sector of society. But we are setting up a special project to reach those areas, to provide sound healthcare assistance. They are as Venezuelans as we are. They call us criollos, meaning national Venezuelan. But they are more Venezuelans than we are. They held out against the Europeans, forcing the Spaniards out. And now that we have the Bolivarian Revolution, we have to care for them. We have to look after them as we respect their culture. Once you are there with them, you learn a lot. You learn about their traditional meals, casabe, manioco, fish. You understand better their point of view and become friends with them. That's why I am thankful to the revolution. And I hope there is always support for the indigenous peoples. It is not only about healthcare. There are some other social issues. That's the main objective of the Bolivarian Revolution, to provide integral social assistance to those who need it the most, people from the slums and the countryside who lacked social assistance. This issue is not new. They were not given the necessary assistance for more than 40 years. There was racism, and they were not given assistance because they were indigenous peoples.
Has it always been like that in Venezuela?
Of course, before the Bolivarian Revolution, there were medical missionaries, but what they did was to take the gold. That's a gold-rich area. That's why it's called La Esmeralda, the emerald. Another municipality is Manapiares, which is another gold-rich area. You could see planes arriving in the area, but what they wanted was to take the gold out. They had sexual encounters with indigenous women. Now you see some of them with green eyes and even blonde hair. Well, the revolution is providing them with assistance without charging a penny. First, we go there and spend 15 days getting to know their culture. to later start to work. As long as we understand what the revolution is about, which is providing assistance to those who need it the most, we will be able to succeed. A couple of weeks ago, I heard somebody saying that we don't take care of the Colombian people, but it turns out that we do. We treat them for free. They come across the river. We give them a pill for malaria. Then they go back to Colombia. We do it because we think that health is a humanitarian issue. Therefore, we support the measures taken by President Maduro. On the contrary, if I go to Colombia, I have to pay for consultations. On the contrary, if I go to Colombia, I have to pay for consultations. But if they come here, we help them as much as we can on the border. And I even provided assistance to Colombian military men. They were wounded. And why do we help them? Well, because we are brothers. We are sister nations. And because we have the Bolivarian revolution in Venezuela. Do you think if there was no revolution in Venezuela, the Venezuelan bourgeoisie would go to the wilds? No, they wouldn't. They would only go if they were to conduct a pharmaceutical experiment. If there's nothing to win, they won't go there.
Let's talk a little bit more, but you're talking about the participation of some Cubans in the program. Tell me more about how Cubans and Cuban doctors are participating in the program.
Our Cuban brothers are not part of this organization. They are part of the Barrio Adentro mission. In the Esmeralda municipality, there is a Cuban doctor. And when we go there, we work together, along with the natives of the area, because we have the same goal, to provide them with assistance. Of course, there is always room for improvement. It's a continuous work. We call upon our colleagues to join us, because when you decide to study medicine, you decide to be a humanist. If you want to become a millionaire, it would be better if you study engineering or architecture. But if you're going to be a revolutionary doctor, you have to understand that you're going to provide humanitarian assistance. That's Guevarism. Guevara is medicine. Go to the countryside and get to know the people, as Che Guevara did. There was the case, he found a group of people with leprosy. Even though they suffer this illness, Che Guevara himself provided them with assistance. If a capitalist doctor go to the mountains, he would be there no more than 2 days, because there is no comfort, air conditioning, hot water, and so on. That's the difference. There are two main approaches, preventive medicine and curative medicine. Which is more social? Preventive medicine. I meet you and talk to you, so you are able to prevent some diseases. And therefore, people spend less money in medicine. But the multinational companies work with the curative approach. As long as people are ill, they have people spending money and they can conduct more experiments.
Sounds like you're saying that on a worldwide level you think sort of the mentality of people who go into medicine in many cases needs to change.
Sí, y lo digo con toda responsabilidad. Mira, qué tristeza da.
There are doctors that deny consultations just because the patients don't have the money to pay for them. And that's not okay, because doctors should help their patients no matter what. Doctors should interact and communicate more with their patients. Sometimes it only takes a few comforting words to help them. The World Health Organization should encourage that, a better doctor-patient interaction. Being a doctor doesn't simply mean that you are part of an elite. I remember going to a medical college gathering wearing very simple clothes, but my fellow doctors were all dressed up with suits and ties. In that moment, I realized that I didn't belong there with them, because I believe doctors should be less pretentious and more modest, more humane, and more interested in helping people. Doctors' interaction with patients is the keystone of care. Venezuela's healthcare system will only improve Once Venezuelan doctors understand that fact and change their mindset, there are hospitals and doctors sustaining the current economic war by denying treatments, claiming lack of medical supplies and medical equipment. But if you go to any storeroom, you will see that there are plenty of supplies. Healthcare is a fundamental right, and as so, poor families should not be deprived of it.
Y tú vas a obligar a una familia pobre a comprar un kit, que venga, que no venga. ¿Por qué lo hacen? La medicina es para todo el mundo.
Since you're going to bring that up, let's talk about that, sort of the medical situation here in Venezuela. In the international media, they certainly have been reporting that there's a lack of medicines, there's a lack of supplies, medical supplies in many cases. But is that the case? As a doctor yourself, have you seen that? And if not, what is the case, and what's the cause behind some of those shortages?
Mira,
There is an economic war currently in place in Venezuela, and as in any war, there are casualties. Venezuela imports most medication and medical supplies directly from other countries, but the Venezuelan government has been targeted by certain countries that want to end the Bolivarian Revolution. So they put obstacles for us to access medicines. Certainly, there are some issues in the healthcare system that need to be addressed, but that doesn't mean our healthcare system is not taking care of our people. However, we understand that there are certain aspects that need to be improved, but the Venezuelan doctors have to understand that they cannot keep sustaining this economic war. As I was telling you before, a doctor cannot deny treatment to a patient, claiming lack of medical supplies while having a storeroom full of supplies. The Ministry of Health and the Bolivarian Revolution work hard to provide hospitals and medical units with medical supplies, but they should work along with the communal councils so that they can have more control on the supplies. A mother or a father will never take a medicine from a hospital to sell it, because they know their child might need that same medicine later. I worked in the Central Hospital of Amazonas, and I heard of nurses taking sutures out of the hospital so that people cannot be operated. I once drove a truck full of medical supplies to that same hospital in Amazonas, to find the next day a sign on the entrance saying that patients had to bring the supplies for them to be operated, since the hospital didn't have any.
Then why they keep saying so if they really have the resources?
¿Por qué pasa? Porque el médico es opositor. Es decir, tiene la mentalidad de la medicina capitalista. Es decir, si nosotros no somos parte de la guerra del sistema, sacamos al presidente, sacamos a este ministro, se acaba todo esto y vamos a estar mejor. Eso es lo que ellos piensan. Y no piensan lo que le estamos afectando a los pueblos. Esa es toda la realidad, se hacen parte por eso. ¿Por qué? Porque ellos quieren ser parte de una política sucia.
Why does that happen? Well, because those doctors oppose the Bolivarian Revolution. They practice capitalist medicine. They encourage this economic war in an attempt to destabilize the Bolivarian government. But they don't see that the only affected by this economic war are the Venezuelan people. They want to end with everything our commander Chavez built by using dirty politics. Those doctors should be punished for what they are doing. They should be imprisoned or have their licenses revoked. But the communal councils should report them. The people should be more involved in this issue. They should supervise and keep an inventory of supplies so that they can prevent doctors from denying treatment and assistance. Those of us who are revolutionary and believe in an integral public system should supervise doctors and hospitals. While our colleagues are in the upper Orinoco River providing assistance to indigenous people, we should be here visiting hospitals to see what they might need, or giving talks in communities. That's the Bolivarian Revolution. We have to keep in mind that we are going through a war, in which international interests are doing their best to end with the Bolivarian Revolution. But they won't be able to do so because the people support the revolution. The youth will defend the revolution. The greatest revolutions were all started by young men. How old were Fidel Castro, Che Guevara, Camilo Cienfuegos, and Ramiro Valdés when they started the Cuban Revolution? How old was the Commander Chavez during his rebellion in 1992? They were all young men, whose ages ranged from 28 to 32. We have to defend the revolution now that we are young, so we can truly consolidate it. We have to defend Chavez's legacy. If we allow them to end with the Bolivarian Revolution, tomorrow there won't be any doctors but criminals, because they won't be having the same opportunities. They won't be having their education guaranteed. That's why we, doctors, should promote and support this revolution. The more than 30,000 doctors formed in this revolution lead by example, just like Che Guevara and the Commander Chavez did. There is a documentary of our Commander Chavez made by Oliver Stone, in which we can see Chavez practicing what he preached. He was the supreme leader of our revolution. He was always leading by example. Nowadays, I'm a doctor thanks to Chavez and the revolution, so I have to honor his legacy. Now, instead of wasting money buying weapons and making war in the Middle East, the superpower should come here and help the indigenous peoples of South America. Why they don't come to Latin America bringing free medicines for the indigenous peoples? Well, they don't do that because they won't be making any profit, which is the only thing that matters to them. I think Venezuela's healthcare system needs to be more unified, and if we believe in this revolution, we need to work hard to see that happen. And the Bolivarian government needs to enforce laws to consolidate this revolution.
Porque así vamos a apoyar la atención integral al pueblo. ¿Por qué? Porque si tú eres médico, no me estás sirviendo en un hospital, te digo, mira, COVID, mucho lo siento, tú eres mi amigo, tú estás ahí, vente, Pedro Pérez, tú eres el que vas a atender ahora. Eso debería ser así. Creo también que la revolución, y estoy de acuerdo que la revolución aprieta un poquitico la tuerca, como se dice en términos criollos, que seamos un poquito más duros para poder hacer cumplir nuestras leyes. Y eso vamos por ese camino.
You were talking a little bit about probably one of the biggest changes and achievements of the revolution here, and that would be the Barrio Adentro program, and along with the assistance of many Cuban doctors. Tell me about how that program continues today, and just for our audience, explain exactly what is that program.
La misión Barrio Adentro nació en Venezuela. La primera misión que lanzó el comandante Chávez fue Barrio Adentro, ya tiene más de 10 años.
The Barrio Adentro mission was the first project launched by the Commander Chavez over 10 years ago. This mission aimed at providing medical assistance to the people living in the slums, since not a single Venezuelan doctor in Caracas wanted to go to the slums because they regarded all the people living there as criminals. Venezuelan doctors didn't want to assist the people. They didn't want to provide medical assistance in the people's communities. In light of that, Commander Chavez asked Commander Fidel Castro to send Cuban doctors so that medical units could be established inside the communities. Now, we have more than 600 medical units throughout the country, providing assistance to the people. Nowadays, President Maduro is trying to promote and strengthen the Barrio Adentro missions and many other social missions. There is a medical unit here in Caracas where we can see the bourgeoisie getting medical assistance, because we exclude no one. If you feel sick, you can go to any of our medical units to get medical assistance. Whether you are against the government or not, that won't matter, and you will be getting assistance. Our social missions have been having good results, and will continue to have those results. That's why President Maduro wants to strengthen these missions by having more doctors working in them. The Ministry of Health and the Bolivarian government will always support the Barrio Adentro mission, as it was the first mission started by our commander Chavez.
Okay, to finish up here, let's go back to the Hugo Chavez Medical Brigade. Tell me what you see for the future. It's very young, as you were saying. What do you see? How do you see that organization developing in the next few years?
Mira, en un futuro que todos los médicos seamos como Chávez.
We hope all our doctors from the medical brigade to be more like Chavez. We don't want them to become elitist doctors. Our organization is an example of the humanistic work our commander Chavez always promoted. So, we would like to see more doctors volunteering in Amazonas, in the Upper Orinoco River, in Apure. The medical brigade is called Hugo Chavez because it's a way to honor the humanistic principles of Chavez. Thanks to Chavez, who was like a father to us, we are doing this work. The idea is for all doctors to have humanistic and patriotic principles. We want doctors to have a more humane approach with patients. That's our goal. We also want to have a more unified healthcare system. We want people to be able to say, I come from a poor family, but thanks to Chavez and Fidel Castro and the Bolivarian Revolution, I'm a doctor. That's the goal. We don't want the medical brigade Hugo Chavez to be seen as an elite of doctors. No, that's not the idea at all. On the contrary, we are simply men and women that want to help this country move forward and want to consolidate the revolution. The doctors from the medical brigade will help their communities and will continue studying to provide better assistance to their people. The revolution will continue. The Bolivarian Revolution will never be stopped. Chavez planted an idea that will continue flourishing. And now, we are responsible for this revolution as it belongs to us, the people.
Esto, lo responsable que la revolución sea es de nosotros y que el pueblo se sienta feliz es de nosotros, no es más nadie. No de la oposición, no, es de nosotros.
All right, Dione Ereu, thanks so much for joining us today to talk about the new organization, the new Brigade, Medical Brigade, but also to talk about medicine in general here in Venezuela. And thank you for joining us for this episode of From Caracas. We'll see you again next week for another episode. For From Caracas, I'm Cody Weddle.